Subscribe if you're tired of hyperpigmentation. It was really these 6 steps from Dr. Alexis Stevens that helped me get my head around what hyperpigmentation truly was and fade it. The tips that I list in this video are in no particular order. They are all just different pathways in which hyperpigmentation can fall. Also going to tap into some products that could be helpful as well that contain these ingredients. So one of the first and easiest tips that I think that you can incorporate into your routine is adding in antioxidants. So antioxidants are just this amazing powerhouse that help you protect your skin from free radical damage. If you're actually using ingredients that calm inflammation before it even becomes a problem, then that's ideal because you want to do preventative measures rather than always dealing with that aftermath. If you can reduce inflammation, you will in turn reduce hyperpigmentation. So some popular antioxidants to consider are caffeine, green tea, aloe vera, cucumber, zinc, and my absolute hands down favorite active ingredient, which is niacinamide. So using tyrosinase inhibitors actually helps you decrease the amount of overactive melanin that is being produced. Tyrosinase inhibiting ingredients include, but are not limited to, alpha-arbutin, kojic acid, vitamin C, licorice root, and azelaic acid, which I have mentioned in a previous video. I'll link that up here. Number 3 is about activation inhibitor. This stops or slows the activation of melanin being created, and there are very few things that even deal with this. Product that actually helps with this is sunscreen. And so did you really think that we were going to go through a whole video and not even touch on sunscreen? Like, what do you think this is? Are you mad? Like, we all know how important sunscreen is in your hyperpigmentation regimen. My advice is this: if you're not consistently using sunscreen in your regimen and you're having trouble with hyperpigmentation, my advice is to log off, stop this video right now, buy yourself a sunscreen, and then finish this video, because there's honestly no point. The 4th pathway to hyperpigmentation that I will mention in this video is transfer inhibitors. So we briefly touched on this earlier when I was talking about niacinamide and how I'm just like #1 fan of niacinamide. So niacinamide is one of these transfer inhibitors, and transfer inhibitors slow the transfer of melanin from being created so that you have time to get your antioxidants in, to do your extra exfoliation, when you have time to actually stop and slow that hyperpigmentation from properly forming and becoming something really unmanageable to deal with. Also, tip, so essentially, if you get hyperpigmentation on Monday, start treating it that Monday instead of waiting for months on end, because that's actually going to create an even deeper scar. It's going to go even deeper into the skin, which becomes so much more difficult to treat. So niacinamide is fantastic for this, but some people are actually sensitive to niacinamide. If niacinamide doesn't work for you, then you can actually go ahead and try adding soy products into your regimen. There was a 12-week study done on soy and its effects on the skin, and it has a brightening effect and also can reverse the signs of photo-damaged skin. So the bonuses of using soy in your regimen is that it can help combat dullness, extra texture, so it's going to smooth out your skin nicely. It helps you with your skin's barrier, so your moisture levels and your hydration levels in your skin are aided by using soy in your routine. And it can also improve the collagen, so that is quite interesting because there aren't too many products that do that. So something else that I wanted to talk to you guys about is exfoliation, gentle exfoliation, and using that to reduce your hyperpigmentation as well. Because when you're using all of these amazing products that are helping get rid of your hyperpigmentation and stop the transfer of melanin and everything, you do want to make sure that you're sloughing off that top layer of dead skin that is just literally there for no reason. So you do want to make sure that you're getting rid of that layer so that your products can actually penetrate as they should, and so that you can see the true benefits of all of that work that you're putting in as well. So you can use use gentle exfoliation by using an enzyme cleanser, which is what Dr. Alexis Stevens actually recommends. She also says that there aren't that many amazing ones on the market, but one good one is the Good Molecules, and they did it in a way where it's not too granular. It's very soft and silky. I've talked about physical exfoliation and how it's not my favorite type of exfoliant, and it still isn't. I use it, but it's basically to slough off all of that other work that I've been doing with my chemical exfoliants. And not everyone can use chemical exfoliation, so that's why I also mentioned this, because it's something that can be very effective, very helpful, and at the same time gentle. But you must make sure that you're not rubbing and scrubbing your skin like a dirty dish. This is an actual genuine reaction because I literally just got this in the mail because I had to re-up on a couple of products because the mailman knew that I was making content today. We're actually going to be talking about what had literally just come in the mail for me. This is a serum that uses tranexemic acid in it. Now, tranexemic acid is actually an ingredient that was first used in trauma patients. So what should this have to do with my skincare regimen, right? So in trauma patients, it was used by doctors to stop excessive bleeding and to constrict the arteries. The patient's skin was getting brighter, more beautiful and smoother, and they were trying to figure out why. So essentially what's happening is the blood vessels that lead to the hyperpigmentation, when you use tranexamic acid, you're reducing them. Tranexamic acid is doing a job that not many ingredients do at all. Literally came in the mail as I was about to talk about it. Creepy. If you hit all 6 of these and you still need help, it means that it's beyond home, and that's completely okay. It's just not everything is going to be able to be fixed at home. Sometimes you might actually have to get the professional treatment done first, and then you use your at-home regimen to support that. The esthetician is a huge part in my skincare regimen. I'm super acne prone, and I like to go to the esthetician like monthly. It's bougie, it's messy, but look, it helps me stay acne free, and then me staying as acne free as possible helps me reduce my hyperpigmentation and my acne scarring. I would much rather hit the acne first than just use my regimen to help reduce acne and then later on be able to fade that hyperpigmentation that I get from that acne. But if I have a smaller amount of acne to deal with, then I'll have a lot less acne scarring to deal with as well, if that makes sense. So that's my logic when it comes to that.